Hello, good afternoon, good morning, depending on where you're calling from. It's such a great honor to be here as part of the CDAC network. I'm really appreciative that after a few years lapse in our activity and membership, we have rejoined, WHO has rejoined the CDAC network. And I wanted to appreciate Mary and Casey's collaboration even when we were not members. It's really an honor to chair this panel, and I really appreciate the opportunity to share the same stage with these distinguished speakers. My name is Gaya. My second name is very difficult, so if anybody wants to have a comment, please call me by my first name. I felt very nostalgic when I watched the two videos. I really missed the time I had early in my career working at community level. And I really wanted to applaud the work of both the case studies and everybody else who's here with great stories to tell. I want to take about the next 8 minutes to share some reflections, and then we'll get to the panel discussion that we're all waiting for. The title of this session is somewhat long, but there are some key words. It's about learning, what we're learning, about communicating and engaging with communities. And the other qualifier is in the harsh context of the COVID-19 pandemic. I don't think I need to tell anybody about the profound impact that this pandemic has had, not just on our traditionally disaster-affected communities, but on all of humanity. I'm going to take 8 minutes, and then we're going to go and have this really interesting discussion. So we've had several pandemics this century. I think this is in the last century, and this is the first one of this century. And it has really brought into sharp focus what we understand by community engagement and what we mean by community engagement. The concept of who is a community, where is a community? How are they connected? How do we communicate with them? How do we empower them? These are all big questions that we are asking. And although I sit in Geneva, far away from the communities that many of you work with, I think our learnings can have something to shape us going forward. So community engagement, obviously, I started my public health career working in communities in a conflict situation in Sri Lanka, which is where I'm from. This is where I learned my public health. But I also found it quite interesting that the UN has also defined what a community is. And we will see this is really quite aspirational, because a lot of the work that many people are doing with communities is much more focused on communication and not real community engagement. I found this triangle quite useful. I mean, why do we engage communities? It is for decision making. It's not as receptacles of our wisdom or our information. It's about developing relationships and building trust. And it's about helping communities build their own capacity. So this is still, I truly believe this is still quite aspirational, and we're not doing this. I wanted to challenge us during this whole meeting to really think about where in the spectrum we are when we talk about community engagement. We saw some really good examples in the case studies where all of these things are happening, all the way to empowering. But unfortunately, much of the work that is done in communities still are struggling with information and informing and maybe consultation. Sometimes people are involved, and then really this is where we want to be. And with WHO, you know, we're a global organization. We don't have reach at community level. We really depend on working with others to really reach communities. And we realized WHO can influence the system to the end, to the front line of the health system, to primary health care. But there is a big gap between where we are and where communities are. I see three big challenges, and some of these were alluded to already. The proliferation of misinformation and disinformation. and really the challenges to communicating risk. And there are lots of studies that show there's diminishing trust in any authority, whether it's a government or a doctor or a public health expert like me. There are barriers to making evidence-based knowledge accessible, acceptable to all communities. And during COVID, we have seen this, that knowledge is generated, it evolves with the pandemic, there's new knowledge that comes available, but how do we make sure that communities are able to access it? On WHO side, we have our own platform for getting knowledge out. We currently have 4.5 million registrations of people who are taking hundreds of courses. And the great thing we've done with many of the partners who are in CDAC is really to translate into local languages to try and lift that barrier and of course remove the barrier of cost and provide low bandwidth knowledge. And really the big thing is, how do we really enable people and communities to take action to really protect their health, really move to the empowerment part of that spectrum. I wanted to just clarify a couple of terms. WHO has coined this term called Emphademic, and it just describes the overabundance of information that makes it difficult for anyone to find evidence-based information and to make sense of this. But we make a distinction between misinformation, which is incorrect or non-validated information spread by people trying to make sense of a situation without the intention to deceive, and disinformation, which is incorrect information, which is done purposefully to distort and manipulate others. So this word infodemic is in the public domain now. One of the issues I think that we've learned is there are many faces to community. Only 40% of the world's population have access to hand washing facilities in their home or in the vicinity. We have rich, poor, low, middle, high income countries who are affected by COVID. We have many, a broad scope of communities that we are trying to address. So this particular pandemic is not limited in time and space, which makes it very, very difficult. Everyone is affected, but in different ways, and how they're affected changes. There's massive scope and diversity of needs, people's cultures, people's beliefs, their vulnerability, capacity, and levels of empowerment. Equity has become an enormous issue. We've seen differences in equity are really amplifying the inequities. The pandemic is amplifying inequities in society. We no longer have captive audiences to talk down to, which I think is a great thing. And we are having to work with communities, each in unique ways. And even communication at the beginning of that spectrum is impacted by fear, uncertainty, evolving science, politics, globalization of communication, active disinformation done by technology and by people, and diminishing trust. But there is some good news. Risk communication, community engagement is now firmly embedded. And I wanted to just share with you WHO's strategic preparedness and response plan and our monitoring network. We have actually 9 pillars and 1 thematic area, but you will see risk communication and community engagement is a pillar in the global response. And this is what has been advised to countries for the pandemic response. And that pillar 2, it monitors a percentage of countries which have a national COVID risk comms and community engagement plan, percentage of countries with risk comms community engagement coordination mechanisms, and percentage of countries that have mechanisms in place to capture community feedback. Now, these are the latest key figures of what WHO has done, and you'll be happy to see. Well, I was very happy to see that we are measuring now how people are at least having access to information. If you look at this, you'll see for the second one, countries that have a COVID risk communication and a community engagement plan, 97% of 195 countries say they have it. Missing is only 6. And if you look at countries that have a global humanitarian and response plan, it's much less. So you can see we're tracking in countries that we consider highly vulnerable as opposed to others, how this is progressing. The global situation is very dire. We have 42 million confirmed cases, 1.1 million deaths, and we expect this to go on for at least 18 more months. So really, these are some of the questions we have. And we talked about technology, but this fourth industrial revolution isn't just about digital technology. Remember, it's biotechnology that allowed us to identify the virus, share it with others, sequence it, and start developing the vaccine and the treatments. So as we go forward in the 21st century and talking about communities, communities are demanding and they have the right to the latest fruits of technology, including vaccines and treatment. And their communication and engagement will also focus on this. So these are just, I don't have any conclusions. I just want to stop here and I want to start the panel. I'll stop sharing the screen and I'm really happy to invite Dr. Naureen Naqvi to speak first. What I'm going to do is I'm going to ask the three panelists to speak in turn and to similar questions. So Naureen, you are the C4D specialist for humanitarian action in UNICEF New York. Naureen, what have you learned about communicating and engaging with communities in the context of COVID-19? Over to you.
Thank you, Gaya. Thanks a lot. And actually, some of your slides are very interesting for me too. Really good learning, and also really glad that you presented some data also, which is very interesting to see. And definitely there are some positive changes in the way we operate already. But just want to bring everyone back to the reality. And the reality when I was looking at the latest global situation report that was recently released by UNICEF internally, still 2 out of 5 people in this world, wherever we operate, they do not have hand washing facilities. So we really need to, consider these key points at the back of our head. The 3 out of 5 children in those countries, they lack basic hand washing services right from the beginning of this pandemic. Then 40% healthcare facilities lack hand hygiene facilities where patients receive care. So, I'm talking about the supply side to it as well, not just really jumping onto the community engagement all of a sudden, and we understand and we know, how everything correlates. So then, since I work with almost all the countries, just want to really appreciate the fact, Jeff, you pointed out that the ongoing emergencies are still there. It's not only COVID in this world, but at this point of time, for a moment, we thought that that was the only disease in the world, that was the only issue. So everybody, all the resources, all the human resource, financial resources were diverted towards that. Till the time came when we realized the socioeconomic impact of this disease as well. So taking it from, just an infectious disease towards how is it going to have a very long-term and long-lasting impact, negative impact on the situation of people who are already suffering from other diseases and also other emergencies. For example, in Syria, I would like to tell you, and you all know the situation in Syria. So I'm talking about all this because I'm also a broader humanitarian focal point as well. So just, the cases remain low, but we need to understand that there is very limited testing in that country. How the biomedical side and the behavior and the community engagement, comes in together. And then going to Somalia, in a very complex crisis, and there is very fragile health system, and then climate shocks are there, but the security risk is there too. And then we move on to Venezuela. You all understand and you all know that COVID is further aggravating the pre-existing economic crisis over there. And as a result, that already there was a lot of migration crisis going on. We have to also start talking about, when we go towards the community engagement, we need to really understand that what about the disruption of health services, So I have a data here that by end of September, the data was end of September, 56% of measles campaigns in 27 countries remain postponed. So we know the impact of those on children. So 105 million children were or are at risk. So we need to really get all those facts straight. Now coming towards the socio-economic. So for out of the survey that we just recently concluded at UNICEF, out of 136 countries, 104 countries that are home to 1.8 billion children reported disruption in services related to violence against children. So that is the big socio-economic impact that I'm talking about. So, and there is a long list that goes on and on. I would also like to bring everyone's attention towards those populations that are not reached by any technology. They are not reached by any regular services. They are either in IDP camps, or they are migrants or refugees, most vulnerable, people with disabilities. So I would like to, learning from this pandemic was, to me, was a real eye-opener for me, because earlier we had disease outbreaks in 1 or 2 countries, so everybody is paying attention, and it's like, we were saying, like, for example, Ebola. And now comparing with that, I think that, oh my God, Ebola work was easy. So this is like a global thing. Even I am in it. I am also one of the community member who is affected by that, because I also have children and they're not going to school and I cannot go out and all that. So my learning was that this was the first time that I saw that there was much more willingness among different technical big agencies and partners to really join hands and sit around one table and start talking to each other as part of the larger team. I will not take names or anything, but just wanted to say that I have seen that kind of change. And that's why there was, creation of collective service for risk communication, community engagement is a brilliant example. That was something that we always dreamed about. It is happening now. WHO, IFRC, UNICEF, and so many other partners are joining in. And we have a regular coordination mechanism to make sure we align and we coordinate. We don't duplicate. So that was the key. The second thing is, as you very rightly said that, WHO providing the biomedical information and the technical side. So how do we take it to the communities? And how do we, listen to communities' feedback also? How do we also learn their perceptions and their behaviors? Because this is not just about wash your hands and use a sanitizer and cover your mouth. What about if I'm a mother living in an urban slum in India? I have like 10 people living in one small room, and you are asking me to, use hand sanitizer when I have no money. And then you are saying that maintain the physical distance. How am I good? What is it that I need to know? How are you going to empower me? So I think there is more and more focus from just sending out messages through different channels to really turning this into more of a dialogue and two-way communication. I know it is not an easy task because the mobility is restricted and, people cannot really go out in the field. And I, just like yourself, I also miss going to the field because I've spent 12 years in the field. So just want to say that the second learning was that we explored how to work remotely in a much better and more systematic way. Digital mechanisms were always there. The tools were always there, but we explored far better than before. How do we leverage those existing tools and mechanisms where we can reach out to more and more populations? Another one was, my learning is that there is just too much messaging going on. This misinformation, disinformation, infodemic, whatever you want to call it. There is a lot. I have seen people's responses to, like, whenever they look at, okay, the messages are everywhere. And now they have stopped paying attention. Okay, it's the same old thing. They're saying the same old thing. It's okay. It's not going to happen. So that is something that we need to look at. We need to also, one more learning is we need to understand that the communities are not just people living in the village. We are also a community here. And we are also influencers on some people. So we need to, the last thing that I wanted to say was understand that community is not just the receivers of messages or receivers of our plans and interventions. The communities have the right to be inclusive, to be included, and our plans or interventions should be designed with them for them to really be empowered, and then making sure that how do we take care of this long-term pandemic effects, because we all know COVID is still here, it's still around, it's going to be here. And I think that if we better prepare communities, we will be maybe doing much better if there is any other pandemic or any other disease outbreak. Thank you very much. I hope I didn't take too much time because there was no time.
Thank you. No, I suppose I'll only be judged on timekeeping, not on anything else. But I think what you said really resonates with me, and I'm sure with everybody else. It's really, really valuable. I'd like to call on Viviane Fluck, Coordinator Community Engagement and Accountability Asia Pacific at IFRC. Viviane, if you could talk about what you have learned. And then after that, I will invite Richard Lace. Go ahead, Viviane.
Right. Thank you so much, Gaya, and also for the really excellent introduction to our panel. I think you covered a lot of the really key point that community engagement is not just a method for us to send a message, and Naureen kind of echoed that as well. And I would like to, highlight the same, but to add to that, I guess, part of that is also being prepared. I think we've all been taken too much by surprise that, we can't fall back on our typical ways of engaging communities. So sending in volunteers and going from door to door. That's suddenly not possible during COVID-19 because of a lot of physical distance restrictions, etc. And I think that is something where we really can feel how important it is that we have built up this relationship with communities before something happens, that we make sure that we can, pre-position some of the materials that might be needed for them to access information, but also to share their concerns, their solutions, and overall their feedback. So I think preparedness is one of the key learnings for me. The second thing is that we really need to make sure that it's not too top heavy in the way that we organize our response. So making sure that when we support, and I think we feel that very much because of COVID-19, because we're all more removed from the field even than we normally would be, that we make sure that, it really goes from the community upwards, but also that we don't come up with a lot of guidances from the very top and kind of suffocates the field level staff that is working directly together with the community. I think we're all in danger of death by webinar and guidance note at the moment. And I think that's also a learning that we need to see, okay, how can we make that into a demand-driven kind of support that is really looking into what are the gaps, rather than trying to just do something because we all feel a little bit helpless, I guess. Those would be my two key learnings.
Thank you so much, Viviane. I understand you and I have something in common. We both speak Mandarin. I did a little research on you. So maybe we could catch up later. But there are really interesting models of community engagement, particularly in that part of the world as well.
Indeed.
People might be surprised by. Next is Richard Lace, Director of Programs, BBC Media Action. Richard, what have you learned?
Thanks, Gaya. I would echo a lot that Naureen and Viv have said, and certainly our experience is that those places where we have had the existing strong relationships and the partnerships in place, and that deep understanding of the audiences and communities that we want to work with, those have been the places where we've seen the response be quicker and more effective. So I would say that preparation that Viv was talking about, absolutely key. Maybe I'll pick up on what Naureen was saying around, I guess, communication fatigue. And definitely that's been something which I think has been come very much to the fore in this response compared to others. And for us, we found that the solution to that fatigue really is about creativity, getting away from messaging and finding ways that we can support communities maybe to develop that broader understanding, the knowledge that you were talking about, Gaya, so that they understand about not just the need to wash their hands, but how diseases are transmitted, how transmission can be stopped. That's something that perhaps is maybe not being done enough right now, I would say. We maybe still focused a little bit too much on campaigns that are driving a particular behavior. And certainly the context I've been working in for the last few years in Bangladesh, we have strong advice that everybody should wear gloves whenever they go outside. Now, is that good advice or not? I think people will be able to understand the nuance of that advice if they understood more about disease transmission routes and the science that underlies it. So I think that importance of helping people to make decisions for themselves by engaging, by building understanding, can really help when combined with a creative approach to communication, and can help overcome some of that communication fatigue that Naureen was talking about. And then maybe just to touch on the infodemic, I think a lot of us on this call, a lot of us in CDAC have already converted to the idea that misinformation isn't just a problem to be solved, but it's also something that can help teach us a lot about the audiences that we want to communicate with. And I think that was true before, and that still stands. It's not just about countering mis and disinformation, but also about how we use that to understand communities better and use rumors to tell us about what people are thinking, what they're afraid of, what they're feeling. I think the other thing we've learned around mis and disinformation is that there's a nuanced way that mis and disinformation emerges. It's not always accidental, and I think it's not always on purpose to do harm. I think sometimes it's a joke which the original sender and the original recipient both knew was a joke, but once that goes wider, it can cause problems. There can be issues around stigma as well that fall into that. And that's something which I think our understanding of how mis and disinformation emerges and spreads has probably developed quite a lot, certainly in some of the contexts where we've been working during the pandemic. I'll stop there for a bit, perhaps.
Thanks. I think we're really hearing some two types of big ideas, and I think I want to thank Naureen for really highlighting the world we live in. 2 out of 5 households don't have, and that was a statistic that really struck me in my presentation as well, don't have water. So to follow the most basic advice, the most life-saving advice to protect from this disease. But also, Naureen, you talked about the bigger context, the millions of children who are not getting vaccinated. Let me add to that, 95% of countries were not on target to meet Sustainable Development Goal 3, just health, forget everything else, before the pandemic. And I saw a blog from the Bill and Melinda Gates Foundation, which says in the first 28 weeks of the pandemic, we were set back 28 years in terms of immunization. So these are the big realities that we have to work with going forward. And then I really appreciate all your learnings, about pre-existing relationships, mechanism, preparedness, trust, and also not seeing things just as black and white. So as Richard said, an infodemic can give us clues into what people are thinking. I wanted to just ask you very quickly, each of you, this is a great forum. So what would be the one thing, very briefly, you would do differently based on what you've learned? And the one thing you would ask the global community to do so that we can continue to engage communities better for the many challenges that we are going to face. And particularly if we look, we know we have a timeline for the vaccine to come out. We're going to have 2 camps at least, those who demand vaccine and those who reject vaccine, right? So the vaccine uptake at community level is something we know is going to come down the line just for pandemic. So just thinking about that, what would be the one thing you would do differently? And what is the one thing you would ask the global community to do? And I'm going to ask you to take no more than 1 minute each. Let's start in the reversed order. Richard, you get to go first. Big
question for 1 minute. Maybe I will talk about, I think we need to rethink our partnership with media partners. I think a lot of us are still using the media to do press briefings rather than helping them build their understanding so that they can then explain things to their audience. And I think we need to think of media as more about community engagement partners than as risk communication partners. And I think as we get into vaccination situation, there may be people who trust the vaccine but don't trust the government or don't trust the person who's giving them the vaccine. And I think the local media can really help hold those government or other authorities to account in the rollout of a vaccine situation, as well as supporting us to continue to engage with communities. And this epidemic has really affected those local media partners very strongly. They're essential in terms of the communication they do with communities, but they were facing a financial crisis anyway. Now it's hit them even worse. And I think we need to really think about how we're supporting them in their role of providing and meeting that public demand for trustworthy information.
Thank you, Richard. What you say really resonates with me. I was a journalist before I was a doctor, so I really understand about the building of capacity and empowering media to be part of that dialogue with the community. And in fact, they're the gatekeepers and they're the storytellers, and they interpret science and global media. Thank you so much. Viviane.
Thank you. I think I would like to highlight that we need to refocus a bit more on accountability. I think throughout the pandemic, we've moved into our comfort zone, which is more in terms of messaging and top-down information giving. And I think we really need to make sure that not only we are transparent, but we're also answerable. And in order for that to work well, we have to diversify internally, but also in the way that we work on the ground, because otherwise that's just not going to work. I think that links kind of together with the other things that were said previously about the importance of the local response, of course. There is a really excellent piece of research that I would recommend everybody to read called All the Evidence We Need by IFRC and CDA, which has several briefs. And one of them really struck me, which is about our internal accountability and how important it is to create kind of environment of accountability as an organization, so that we can also make sure that we are accountable to communities, because a volunteer knows that if they complain, something will happen. And so they also know that they need to respect the voices of communities that they're working with. And I think that is something that we often forget about a little bit, because it's difficult and it's challenging, especially when we work remotely as much as we are at the moment.
Thank you so much. I saw, Naureen, you were nodding, as was I during that. So what is your one thing that you'd like to change yourself or in the global community?
To be very honest, I mean, all of us are just so overloaded with work that sometimes it's even very difficult to step back a little bit and look at what we are doing and how we're doing it. And that's the main challenge these days. But I believe that how I have changed a bit, especially learning about more socioeconomic impact, is like, so I am trying to, I just conducted a survey with all the 7 regions wherever UNICEF operates. It's basically to really get to know the regions a little bit better, not about the study or the research. What are the 3 key issues that are emerging from the region? And really kind of, based on my technical support on the basis of what are the needs of the regions and the countries, rather than me sitting here at the headquarters or working with Geneva team, deciding, okay, this is the guidance that you need. There were over 100 guidances produced during COVID. Technical guidance, and so imagine there might be one risk communication person in a country office who has to respond to all the requests and everything. So just imagining that. The second thing which I would like the partners to do, to really take this opportunity. Unfortunately, this pandemic is also fortunately an opportunity for us to really sit together, honestly sit together and systematically. We need to first of all prepare people. We need to prepare them. We don't just have to say that. preparedness has a lot of actions, prepare them, and then we need to coordinate better. Coordinate everything that we do. We don't need to duplicate anything. The third thing is that we need to empower the communities. The empowerment has a lot of, explanation, and there is a long list of actions under empowerment, and one of them is capacity building. But then also looking at, the last thing is that looking at the system, because we are not just responding to a disease outbreak right now. We see the system collapse, and we see there is no money and there are no resources. Some governments are not supportive. There is conflict going on. So what is it that we can do? Where should we invest? It's a system strengthening. And that's the last thing that I wanted to say. But then looking at the community, really looking beyond yourself. I want to end by quoting one young champion that I was talking to in Nigeria. She said that do not look at us as part of the problems. Everybody's saying the young people are spreading the virus and the infection and all that. We are the solution, not the problem. Empower us so we could support our community. So those were the actual words from that young girl from Nigeria. Thank you very much.
Thank you, Naureen. Very, very inspiring and absolutely wise and true. I'm going to wrap this panel up and thank you all. I wanted to share a parting concept with you as well, something that I've been feeling. I totally agree with what was said about, first of all, the systems approach. And when we take a systems approach, we're not looking at a hazard or a risk, but we're looking at how people interact with anything in their environment. And community engagement, knowledge, all of this is related. It has to be seen in a system, and some people would say a networked ecosystem. Because we used to think, there was a line between knowledge and recipient and so on. I think the second thing I'd like to say is, in this complex environment, I totally agree, Richard, when you talked about Emphademic. And that's why somebody who's in charge of learning and capacity development is involved in this. We really see this not as bestowing anything, but really looking for ways to engage community so that they can define what they need, how they need it, how they can learn, how they can build capacity. So that transition from science and information all the way to sense making, contextualization, personal beliefs, personal choice for risk, all of this can be considered. I really am excited by, like all of you, about what we've been able to learn and what we are sharing together. I really, it's not a question I'm going to pose for you now, but I hope by the end of this 2 days with CDAC, I hope that we're able to really set for ourselves a target this time next year. What would we have changed? In a way, the pandemic is pushing us to change. Some of us are using tools better. Some of us are understanding community is not a time, space bound entity. Many, I think all of us understand that we have to go well beyond communication. But where would we be? How would we be addressing towards the tail end of this pandemic? When we have therapeutics, we might have vaccines for some people, but we are so behind in the development and humanitarian agenda. We really have regressed in that. And that really pains me. But I think I would really like to leave this panel with my gratitude for your ideas, your passion, your insights, and sharing your learning, but also challenging all of us who are here and who are not. What is it that we really aspire to change by this time next year? What is it we must do in scope, in scale, that would make that difference? So thank you so much for everybody for being on the panel. Thank you, organizers, for inviting me. I'm no longer mainstream community engagement tribe, but please know you have a champion, and we really are looking to learn from you, to participate in this joint learning. And I think this is how we're going to learn in the 21st century. It is basically about being honest, being frank, but also being aspirational and willing to share. So thank you, and all the best for this meeting. Thank you very much.